Hello guys. This is Dr. T. Um, so yeah, welcome to Clinical Medicine with Dr. T. I know people have been saying that I don't show myself often when I do my tutorials. Guys, it's not about my face. It's not about my face, guys. But there you have it. This is me. Okay, so I've been getting a couple of messages, people asking me, especially students that are doing medicine in or at the University of Pretoria, those who are studying SIC. So they've been asking me questions. Okay, Dr. T, what would be your advice, tips, for someone who's going into SIC to make sure that they do well and that kind of a thing? And because I've been getting a couple of people asking that question, so I just thought, okay, let me just do a video on that. My experiences might differ from other people's. I'm sure if you can take up maybe about 20 people that have gone through SIC that are doctors now, who are in UP, their experiences will differ here and there. So guys, my advice is that, okay, for those who don't know what SIC SIC is the last 18 months of medical school. It's called SIC, Student Intern Complex. So basically, from the second half of 5th year, that's when it starts, like in July, up until, so it's gonna be the second half of 5th year in the entire 6th year, 18 months. That's SIC. So the rotation that you do in SIC, you do them once. So if, for instance, in July you do some rotation, you are done with that rotation with that rotation forever as a student. You're not gonna do it again in 6th year. So basically, SIC is the last 18 months, which is like the final year or the final 18 months of medical school. I know there are other universities that have got a similar program, and the other similar kind of a setup in terms of their program, and then there are other universities that do have SIC. But SIC and doing clinical rotations in a university that does not call it SIC is not really different. The different thing is that in UP, as an SIC, you take a lot of responsibility. The studying is on your own. Yes, you are gonna have tasks, but the studying is on your own. And that's where it becomes tricky. The studying, yes, they will give you tutorials and all those things, but you need to push yourself. And also, you are given more responsibility because you do more calls than ever. You are given a lot of patients that are going to be under your care, in the sense that you need to know what is happening about that patient or about those patients, depending how many you are and what rotation are you. Like in telemedicine, we had about 6 patients. Each SIC had about 6 patients that you had to know what is their diagnosis, what bloods need to be done, what bloods have been done. And it was, guys, it was a little level whereby the registrars will even give you their login password for lab track, so that you can use your phone to check the patient's blood results. And when the blood results are not done, if there's anything that has not been done on the patient or for the patient, the consultant does not ask the registrars or the intern, they ask you as the SIC, why was this not done? Why was this not? That's why the SIC, that's why the intern and the registrars are on your neck to make sure that everything is done, so that when the consultant comes, there are no issues. It becomes very long, guys. SIC becomes very long because there's just so much responsibility. I remember when I was doing obstetrics and gynae, especially gynae, I used to be at the hospital at 6 o'clock in the morning, 6 o'clock, because at 6:30 or at 7, the registrar had to come, and then around 8, 9, the consultant will come. So which means I have to see my patients and do everything so that by the time the registrar comes, I've done my work for my patients. And then we just walk through the patient. And then the consultant comes again, then we do the same thing. We go through the patient as again. So, and also, guys, it was crazy. As I said, it was crazy. It was painful. People cried. People broke down. People, guys, we did so many things. We cried, guys. We cried. It's very emotional. MBCHP is very emotional because of the amount of work. Amount of work. And I've always said this: medicine is not for clever people, but it's for people who are willing to work hard. That's what it is. It's for people who are willing to work hard, who are willing to sacrifice a lot of things so that they can have the degree. Even as a doctor, when you're working, you sacrifice a lot. You sacrifice so many relationships. You sacrifice from so many friendships. You sacrifice a lot of things. That's just how medicine is. And I'm not saying it's a nice thing, but that's just how it is. That's how we are all swallowed in this thing. So that's how bad, gynae is one thing that made a lot of there's no student who loved gynae because of that 6 o'clock, especially when you are in Steve Biko. It was even better in California, but Steve Biko, 6 o'clock, you had to be there. Some students even came at 5, some even came at 5:30. So it also depended on how many patients did you have, but there's no student who came after 6 o'clock. It also said that it also bad. Some students would even check patients' results from home. They'll just take the barcodes so that when they get to the ward, they just start writing. Yeah, well, so it was, and also the studying. You had to study, you had to read, you had a lot of things going on. Yeah. So I don't want to lie to you guys. Prepare yourselves. Prepare yourself for SIC. It becomes long. It becomes taxing emotionally, physically, spiritually. So try to get as much support as you can get. Try to get as much support. If you've got people that can support you academically, keep them. If you've got people that can support you spiritually, keep them. If you've got people that can support you financially, yes, you have to keep those ones. So keep anyone that will give you positive energy, and do the things that will also give you positive energy. Jogging in final year gave me positive energy, so I used to jog a lot whenever I had time. Played soccer as well. So try to look for things that will give you positive energy as you go through SIC. So coming to now my tips. One thing about clinical medicine: fall in love with a doctor who will call you guys and say, let's go, I have a patient in ward so and so. Fall in love with that person, because that's what clinical medicine is about. Because if you cannot elicit signs on a patient, if you cannot examine a patient, if you cannot pick up clinical signs, you are gonna struggle on your oral exams. It's not a lie, guys. You are gonna struggle. You don't want to be that person who can't even pick up pitting edema. You don't want to be that person that cannot pick up an obvious memo. You don't want to be that person that cannot even measure the liver span, who cannot elicit fluid trail, things like that. And those things are not in the textbook. You cannot learn those from the text. The textbook will tell you, but you cannot, it will not teach you how to elicit with confidence. But a doctor who takes you to a bedside, fall in love with that person for clinical medicine. That's your guy. Whenever they say, do you guys mind waiting? I'm in a meeting. Can you wait an extra hour? I'm gonna take you. I've got a patient that I want to show you. Keep that guy. He's your guy for clinical medicine. I know students will be like, let's go and study. Let's go and study. We are gonna go and study, but study about CCF, but you cannot even pick up the clinical signs of CCF. And when guys. I know sometimes as students, the way we think is somehow, because we are always thinking, I want to go and study, I want to go and study. You're going to go and study the same things that you won't even remember when you come back in the morning. But when someone shows you how to elicit a sign, it's likely to stay. So keep someone like that in your pocket. That's number one. So I'm saying respect bedside teachings in all rotations. Sometimes you might even get the same patient for your exams and you'll just flow. I mean, CCF is CCF. Corpulmonale is corpulmonale. If they show you, they take you for a bedside teaching for a patient who's got corpulmonale, you are done with corpulmonale. You can go now and build on the theoretical side of corpulmonale. So when they ask you questions, you can be able to answer. But when it comes to eliciting symptoms, signs, you are fine. That's one. Number two, try to attend all the tutorials. Try to attend all the tutorials. Try to attend all the ward rounds as much as you can. Because there are things that these doctors, the consultants, they discuss that when you read the textbook, you won't understand, or you won't even think it's important, and bam, it's in the exams. Because remember, oral exams, you cannot predict how oral exams are gonna go. They can go in any direction depending on how they feel and what information are you giving them. Sometimes they can ask you something that some consultant mentioned during the rotation, then they ask you in the exams, even though you didn't read anything about it, but you just remember what the consultant said, and then that's just enough to give you good marks. So in clinical medicine, listening and attending becomes very crucial for clinical medicine. Yes, theoretical, and then for theory, studying is good. Like for theory, studying is good. It's very, very good. Like if you're gonna do written, they ask you list 10 causes of anemia. That's fine. You can list 10 causes of anemia. You need to rate to know those. But clinical medicine is different. Especially if they give you, they ask you to go and examine a patient, then you come and present to them as your exam, as a form of your assessment, and which is going to happen in the rotations. So learn to attend tutorials and listen. Ward rounds. That's point number 2. Number 3, try to be proactive as much as possible. Ask questions, listen and answer. When they say, I know as students, we've got this thing that if they say, okay guys, if a consultant comes or a registrar comes and say, okay guys, go and see that patient, take history, do examination, and write your management plan. I'm gonna come and discuss the patient with you. And then maybe there's 4 of you or there's 5 of you, and then you start looking at each other. Okay, so who's gonna do it? Jump at that opportunity. The people that were with me in the rotation, they will tell you, jump at that opportunity. I'm not saying you must be selfish and want to do everything by yourself, but most of the times, students, they become very shy. So jump at that opportunity, because when you take that history, you will be corrected there. You won't fail there. You'll be corrected there. And as you are being corrected, you are picking up something new. It's hard to really learn and appreciate when you're being corrected, when you're not on the hot spot. Like if we are 10 and I'm the one presenting, when questions are coming, I'm the one who's learning much better than the person who's just sitting there under no pressure. So when you keep doing that a lot, there's kind of information that you receive that other people do not have, that other people do not take serious. So if you do it a lot, by the time you go for exams, you're also ready. And also, if you're a shy person, you don't want to talk, you don't like talking, when you present time and time and again and again, that thing of you being shy sort of like fades away as you keep doing that. And also, you keep answering questions. If you struggle to answer questions when we are 10 in the room, you are going to struggle when you are the only one answering those 4 consultants. They are busy bombarding you with questions during a clinical examination. So learn to do it. I'm not a shy person. I always tell people that, personally, clinical examinations were my playground. If you can compare my marks from first year, second year, third year, yes, I had like okay marks. But when I started doing clinical medicine, all of a sudden I was getting distinctions. All of a sudden I was getting like very good marks, above 70. Most of my marks are above 70. So it's simply because I enjoy clinical medicine, and I'm not a shy person. Talking, presenting, answering questions is my playground. Even during ward rounds, I was one of those students that used to answer questions. And it got to a point whereby if we are being asked questions and many people are struggling with the question, if I don't know it, then the group is like, yeah, ne? If I also don't know it, then it means this is a very difficult question. And so it was that kind of a thing. So my group, they knew that I used to answer questions, I used to get involved, I used to present, I used to try to do the things that people don't want to do. Even as an intern, I try to see patients that interns don't want to see, because it's usually difficult patients. I enjoy that because I know, as an intern, if I see a difficult patient and I've got seniors, they are my backup. Unlike when I'm gonna try and see a difficult patient when I'm the only one now that I'm seeing a patient that I've never seen before, it's gonna be difficult. So as long as there is support, as long as there are people around me, I will swim to the deep. Okay. So that's point number 3. So I said point number 1, you must respect all forms of teaching, like tutorials, word rounds, all that. A person who keeps you to a bedside, who calls you to a bedside teaching, that's your guy. Love that person. Whenever, love that person. Is going to help you in clinical medicine. So, and another thing, it's impossible to study and be ready. Rotations are like 7 weeks. It's impossible to know everything in 7 weeks. And there are things that you will study, and then there are things that you won't get a chance, or you won't get the time to study them. So which means now, you listening to the other things that people are saying, listening to attending tutorials, word rounds, all that kind of a thing, will help you for the things that you won't have a chance to study. So it's important. And when you study, try to study. There's one thing that this other consultant once said. He said, he was a registrar, cannot remember which rotation. He said that when you are a first year medical student, study as if you are a second year. When you are a second year, study as if you are a third year. When you are a third year, study as if you are a fourth year. When you are a fourth year, study as if you are in fifth year. When you are a sixth year, study as if you are a sixth year. When you're a 6th year, study as if you're an intern. When you're an intern, study as if you're a medical officer. When you're an MO, study as if you are a registrar. When you're a registrar, study as if you're a consultant. And I kept that. It made so much sense. I kept that. So whenever I would, that's why I have got this approach. The way I approach even in my tutorials is something I learned in medical school. Like, okay, for me not to forget this, let me ask myself a question. If a patient now with a chest pain comes in, what will I do? What will be my thinking? How will I approach this patient in terms of the history, examination, differentials, and all of that? That's why many of the things that I'm sharing now, I just have to go back and remind myself about a few things, but the gist of the work, the core is still there. So study knowing that one day you want to be a doctor, and decide what kind of a doctor you want to be. And one thing that I know some people might beg to differ, for me, the way I say it, a lazy student becomes a lazy intern. A lazy intern becomes a lazy MO. A lazy MO becomes a lazy consultant. Doesn't change. Doesn't change, just how it is. And I know there are people who want to specialize because they think that specializing takes away a lot of work from you, a lot of responsibilities from you. When you have got that kind of mindset that you want to specialize so that you can minimize your work because you're a consultant, it means your registrars are going to struggle because you're going to throw everything at your registrars and go home and sleep, which is not the way. Which is just not the way. Yes, I know there are consultants who leave registrars alone and all of that, but we shouldn't study to be those kind of consultants. So, but it doesn't start as a consultant, it starts as a student. That's where it starts. Are you lazy? Are you, so it doesn't change. It doesn't change. Many people do not specialize because they want to be great consultants or they want to have a good impact wherever they are, whatever. No, some people want to minimize their hours in the hospital, and that's just how it is. So always remember that as you study, one day you'll be alone, and also this is what I wanted to say. You know, when one thing that I hate not knowing. I'm not arrogant, but I hate, and it's something that is just in me, that I cannot be asked a question today and I'm clueless about it, and then tomorrow or next week someone asks me the same question and I'm still clueless. I hated that. I mean, I get so I don't want, I don't know what phobia it is, but I've got a phobia of not knowing. Like, I hate not having a clue about a patient. I hate not knowing what to do with the patient. I hate not knowing an approach to a patient that I have. So, and like I'm saying, as a student, I hated to be asked a question and then I'm clueless about it. At least I must have clue about it, and then I go now and study more because I couldn't answer the way I was expected. So to be clueless, I hated that. And I hated, it's even worse when a consultant asks me a question today and then tomorrow I still don't know the same question that he asked me yesterday. That says a lot about you. It says that you don't care. It says that you don't take your work serious. So I hated that. That's why whenever I had a question that knocked me out, when I get to my place, I would go on Google, look for an article and read up until I know it. That's another thing. My colleagues, even from someone just reminded me a month ago that actually I started reading articles even from third year. I remember using articles kakulu a lot when I was doing final year. In final year, I stopped using textbooks. And the reason for that, I mean, in UP, we had access to up-to-date. Yes, up-to-date can take your time, especially because there are so many links Don't follow all the links. Don't follow all the. Focus on what you are studying. So I use a lot of up to date. I use a lot of British medical journals. I used a lot of American Physician Association articles. I used a lot of which I still use now. It's just I don't have access now to British Medical Journal, but I loved. If you've got if you've got access to British medical journals, go and look for the articles. They are so beautiful. So it got to a point where now people are also asking, "Ma, what am I using to study?" And I was telling them, I'm using articles. I was not using textbooks. Textbooks, they've got outdated information, number one. Number two, I struggle with textbooks, guys. Oh, I just struggle reading a textbook. Because an article I can search maybe for whatever topic, and then I get a 6-page or 11-page article, and then I know if I read that 11-page, I've got all the information that I need. So I use articles. So if you've got access to articles, read articles. What else? So basically, it's that avail yourself. Never deny yourself of clinical exposure. If the hospital, they say you must come in at 7, and then usually in UP, you come in at 7, depending where you are, you can leave at 4, you can leave at 6, you can leave at 5, you can leave even at 1, sometimes depending the rotation. But most of the times you've got a TAT in between, maybe you've got a TAT at 11 or a TAT at 2, things like that. So never deny yourself of clinical. I know there are doctors that wouldn't really care whether you are there or not, but take it personal and say, I want to be there. Because there are things that you will see once and never see it again, and then you just, bam, you see it as an intern. But just because you presented yourself that day, you still remember the condition. This issue of going to hospital, seeing patients, seeing how things are done, how a clinic is run, the tests that are being run, how are they run, things like that. Those things, they help you. It's like picking up mileage. You know, if in a week, for instance, there is 2 of us, and I go to hospital, and in that entire week, I've been exposed to patients in that entire week for about 40 hours. And then you have been exposed to patients for 15 hours. I should be better than you because I was there 40 hours and you were only there for 15 hours. I should be better than you. But now the thing is with students is that they want to go and study on their own, sit in the library and study a lot of information. But now when they come to being examined clinically, they struggle. Students who love to read a lot, who love to, who take responsibility for their studying, that, okay, now I can do this on my own, I'm going to read on my own, they tend not to attend clinical and meetings like your ward rounds, all those things. They always want to go to the library and study by themselves. Those ones will have the theory. But now we're talking about clinical medicine. Those are the same students who won't even be able to elicit a sign. Those are the same students who won't even know what. For instance, they can ask you, okay, a patient comes in with retention of urine, and you go through it, okay, these are the differentials. You come with the differentials, and yet your differentials not even patient-based. It's something like they are, it's not for your patient. Only to find out that, and then they ask you, what investigations would you do? Because you have been reading a textbook, you start talking about CT scans, MRI, wara. That's the difference between someone who has been to the clinic and someone who has not been to the clinic, like who has been exposed to the clinical stuff. Like at the clinic, they'll start doing a dipstick, or in the ward, they start talking about a dipstick, start talking about like basic things. But the book will just tell you about MRIs, and if you have not been to the hospital enough, you won't know that even this MRI is something that is very complicated. You need so and so to sign it, wara. So the basic things, you didn't mention them. Even the basic bloods, or you mention, I mean, that's the difference with clinical medicine, is that you need to be there. Because if I'm in the ward and I see a patient who has got upper GI bleeding and I know what they did for that patient, I know about upper GI bleeding. I can just go and study now the theory, so that when they ask me about classifications, I know them, wara. But when they ask me how will a patient with upper GI present, the patient that I saw with upper GI is gonna click to my mind, and I just tell them what I saw. Okay, this patient can present like this, and I know that I was with Dr. So and so, and Dr. So and so did A, B, and C, and I just tell them, and then they think that, oh, this student is so good, and yet you are just telling them what you saw, and obviously backed up with your own information that you read and stuff. And as a student, if you see a patient once, that patient stays with you. That patient stays with you. That patient stays with you. You always remember that patient, how they presented, and all of that. So guys, that's what clinical medicine is. Clinical medicine is about you being there in the hospital. It's not theoretical. You can pass anatomy without even seeing a cadaver and get 100%, without even seeing a cadaver, without even dissecting it and get 100%. But clinical medicine is different. You can pass biochemistry, you can pass biochemistry, you can even pass chemistry without having been to the lab and do any chemical reactions and still get 100%. But clinical medicine is different. If you're not there, I'm telling you, you're not going to get good marks. You need to be there. You rather spend your time in the hospital and spend a little time studying, because once you spend a lot of time in the hospital, you see how patients are being treated. And also, if you're that person who looks and check, for instance, if they see a hypertensive patient in the clinic and then you see the drugs that they've written, oh, they wrote HCTZ, they wrote amlodipine, they wrote enalapril. Now, when they ask you about drugs that you can use for hypertension, you will remember those drugs. You won't start mentioning hydralazine. You won't start mentioning things that are in the book that you're not even told that they're not first-line drugs. But when you see that one being done, it means it's something that is done in the hospital where you are working. So you won't be too much off. Yeah, I'm not saying you cannot be using her, but you cannot just be using hydralazine as a first line. But if you mention, if a consultant asks you, okay, what drugs can we give this patient for hypertension? You mention hydralazine. Hydralazine is like the fifth or sixth choice in terms of, it's not the first choice, second choice, second, third, or even fourth choice. It's down there. Now, if you mention it, that's how someone who studies a lot answers. They answer things that are in the textbook, but not things that are being done there. That's how people fail. And you've got a lot of information, you know the work, but it's just now you have not exposed yourself clinically. Guys, I cannot overemphasize this thing of going to the wake up, go to the hospital. You know, the people that were with me in my group, they will tell you, I hardly missed ward rounds. I don't think I've ever missed ward rounds. I hardly missed tutorials. I hardly missed clinical exposure, guys. Just being there is so helpful. I was thinking of something. There's something that was just on my mind now. So for you guys who are shy, you presenting to your, yes, you can practice presenting to your friends in the room at res, but learn to answer questions. Learn to be that person when they ask a question, don't ever be afraid or scared of being wrong. Don't ever. Because when you are wrong, the registrar doesn't really mind. He understands. Now, your problem is you are shy, but you are with your own people, like your own people that you have chosen in your group to be with you. So it shouldn't be the case. And also, you know, one thing that also made me not to be shy, I knew that when I'm being asked questions, I used to get a lot of questions right. I'm not being arrogant, guys. I used to get a lot of questions right. So the day I make a mistake, and it wouldn't bother me, because about 80% of the times my answers are right. Whether I was in internal medicine, whether I was in surgery, whether I was in wherever, 80% of my questions were right. I used to study, guys. I used to read. I still study. I still read even now. So yeah, guys, that would be my. If I remember something, I'll post it again or just write it on the comment section. So be that student who's proactive, be that student that respects clinical exposure, and you'll be that intern that you don't, even if they leave you alone, you'll still be fine. You'll still be fine. You'll still be okay. Yeah. So guys, that's my insight into SIC and the tips that I can give you as you do your last year or your last 18 months, depending what varsity are you in or studying, which varsity are you studying. So thank you so much, guys. Bye.